Hello, my name is Dr. David Kulla here in New York City with Synergy Wellness, and today I'm going to show you a common boxing injury or mixed martial arts injury that we see when a fighter throws a punch. Now, I'm no fighter, I'm a lover, not a fighter, but when a fighter throws a punch, a lot of times the person extends the elbow all the way straight. And as far as I've learned from boxers and other professional fighters, you're not supposed to do that. So at the point of impact, whether it's the bag or someone's face, hopefully not, but you want that elbow slightly bent. So at a 5 or 10 degree bend, I'm not sure on the angle percentage-wise, but a slight bend so that when you do have impact, you're not hyperextending your elbow, first of all, and also you're not causing your shoulder joint, your glenohumeral joint, to shift forward. And that's what he did here. He was boxing recreationally and aggravated his shoulder. So we're going to do a shoulder assessment and just make sure that's what the injury is. But some other common symptoms you would find with that would be when you reach forward, you might have a little pain or discomfort or tightness, or maybe it feels like it's going to pop out. Just depends on the degree of subluxation in the shoulder joint and or elbow. And we're going to check his elbow as well. So arms out. So we're checking right now for an anterior humerus. And I always tell this joke, it never gets old. There's nothing humorous about an anterior humerus. But that's the name of the bone, the humerus bone, from here to here. Okay? So we're going to push down, resist. This was weaker. Was it a little painful?
No.
Okay. So this was definitely weaker. We're going to definitely, that showed up positive. We're going to correct that. Then we're just going to check a few things here. And 1, 2, 3, resist. Good, and resist. So he's had some clavicle issues in the past, some shoulder issues that we fixed. He just re-aggravated it in boxing. So I'm just double checking, going through a couple tests here. And this one here. And resist. And resist. Good. And resist. Good, no pain, right?
Nope.
And make a fist here. And resist. Any pain there? Okay. Relax here. So now I'm going to have you sit up and face the camera. So there are several ways, have a seat right here, several ways to adjust a shoulder and several ways to adjust an anterior humerus, meaning his left shoulder, the glenohumeral joint, the humerus has gone forward inside the glenohumeral joint. Okay, and we're just going to correct that. There's a lot of different ways. I'm going to be a little bit more on the aggressive side with him because I know what he can resist, what he can take. He's in good shape. We worked on his shoulder before. We cleared up his neck and shoulder issues for the most part in 4 visits, I think. So, and a lot of it had to do with his shoulder at the clavicle, but that is not involved. I just tested that. So we're going to do an anterior humerus, and then after I correct that, we're going to check his elbow. So again, many different ways to do this. Do not do this at home. Do not try to do this on your own. Relax here. Okay, and lay on your back. And we're going to test that again. Arm out. 1, 2, 3, resist. Okay, much stronger there. Now I want to check his neck. And his elbow, of course. So we're going to run through a couple elbow tests here on the affected shoulder side. So I'm like this. I'm going to open the arm up, resist me. Any pain?
Nope.
Okay. And I'm going to push it a little bit more. Yeah, there we go. And 1, 2, 3, resist. Any pain? And 1, 2, 3, resist. Any pain? Okay. And that's it. There you have it. An anterior subluxated shoulder, corrected that way, and we'll check him again next week. Thanks for tuning in, everyone. Thanks for being our model today.